the rural health agenda. And it's
Yeah.
yes, a stat that you cited that really was shocking to me. You from a study from the Center for Healthcare Quality and Payment Reform, and the stats this: more than 600 rural hospitals, nearly 30% of all rural hospitals in the country, are at the risk of closing. Before we dive into what's in your package, why is this happening?
This is happening in large part because of reimbursement rates. And Senator Warner and I have worked in a bipartisan manner to address this issue, this specific issue. It has to do with the area wage index. And Brittany, one of the things that is so important to realize is that when you talk about reimbursing hospitals, a piece of equipment is going to cost the same thing in rural Tennessee that it costs in Midtown Manhattan. So the disparity in these reimbursements has made it very difficult for these rural hospitals to keep the doors open. Generally, these are the hospitals that have more Medicare, more Medicaid, and less private pay in their patient mix. So making certain that we address these discrepancies that have come into play and that we move this to parity so that these hospitals are able to keep the doors open, and so individuals that live in rural America have access to affordable health care, and they have access to quality health care right there in their communities. This is the reason we are focused on this issue. And we're so pleased that we've been joined by senators from each side of the aisle in supporting this legislation.
Like you said, all three bills are bipartisan: the Rural Health Innovation Act, the Rural America Health Corps Act, and the Save Rural Hospitals Act. So, can you just give us a highlight reel of each of the bills?
Yes, indeed. The Innovation Act will allow for areas where they have lost their hospitals, and Senator Hickenlooper and I are leading this. They can do freestanding emergency rooms, and actually, we were so pleased that CMS granted a waiver to Fentress County, Tennessee, and the University of Tennessee Medical Center to open one of these facilities in Fentress County. They had lost their hospital. And we had worked closely with the teams involved in this to make this a reality, and were able to cut the ribbon on it and have it put into action in late June. And my understanding is that people are showing up there every day. But having these centers where you can use technology, you can use health IT, you can use telehealth, you can use digital imaging, and properly triage an individual and then get them to additional health care if it is needed. Get them to the right place and in a timely manner. Now, Senator Durbin and I have worked for about 3 or 4 years on this Rural Health Care Act. And this would encourage, it would incentivize individuals to move into rural areas for the practice of medicine. It may be nurses, NPs, PAs, physicians, psychologists, psychiatrists, optometrists, ophthalmologists. You might have EMS personnel. You might have dentists. But when they do this and they practice in this area for 5 years, their loans, their student loans, are forgiven tax-free. And this is a tremendous incentive to individuals to start those practices in rural America. And Senator Durbin and I are continuing to work on this issue.
And what has the response been? Obviously, student loan forgiveness has been a lightning rod issue as of late. So, are Republicans on board with that?
You're talking about the lightning rod was the way the president tried to use executive authority. He cannot do that. This all has to come through Congress. That is why there is legislation and a orderly process, regular process for addressing these issues. And this would be very targeted. It would be something that focuses just on rural America for access to health care, which is an issue that exists in each of our 50 states.